Emily Holzberger and Iris Tan here from the Institute of Sports and Spines. We're going to be having a bit of a discussion today, letting you guys get to know us a little bit better. So we'll start out. Iris, why did you become a chiropractor?
Well, my dad was actually my inspiration of me getting into this profession. He had a really bad low back issue which stopped him from walking and doing the things that he loved. And the surgeon said that he can't actually go for a second surgery because it will mean that there's a higher chance of him being paralyzed or something bad happening. So one of his friends actually introduced him to see a chiropractor back in Malaysia. And since then, he's been amazing and he's been backpacking. So that really got me and my sister very intrigued on the profession. And we started from there and have loved it since and wanted to help more people like who is suffering like my dad. Yeah.
So apart from working here at the clinic, you also work at university. Tell us more about that.
Yes, I do. In fact, I actually work at Central Queensland University in the Brisbane city. It is the first university in Queensland offering the chiropractic course, which is very, very exciting. And I'm there lecturing or teaching the foundations of the chiropractic technique. Apart from that, I also am the supervisor in the student clinic for the final year chiropractor. So I'm there making sure that they graduate with the skills and knowledge that they need to be confident in treating the public in the future. Yeah.
So tell us about some of the treatment techniques you use with patients.
It really depends on the patients themselves and what they present with. But in the standard or general day, I would start off with adjusting them, or what we call manual therapy. It's the one where we hear the crack, and a lot of people associate the cracking with the chiropractic, so that's the one that I will start off with. But I also add on a lot of muscle work to get some of the muscle tension releasing at the areas that the patients are having pain or where they're feeling stiff. And then on top of that, just to give them a bit more homework to do, because at the end of the day, it's all about me and the patients working together. I'll give them home exercises to do, just a bit of stretching or even some strengthening so that the pain would reduce in a long run. And for patients who, not everyone really likes the cracking or the adjustment, I would actually use a more gentle approach. So we have things here, fortunately, in IOSAS machines like the shockwave therapy or the TENS machines that will help with patients who don't like the cracking sound. Yeah.
So Iris, what's the most important thing to you in terms of patient care?
The most important thing to me in terms of patient care is spending time with the patient to listen and understand what their conditions are or what injury they have, because with that it will help me tailor the necessary plan that would be suitable for them as an individual, adding into their lifestyle factors and the circumstances or the needs that they require to keep them on the plan. So basically it's just getting the compliance into it. So yeah, so listening and understanding is very important to me.